People of New Jersey, especially those of you with Horizon Blue Cross Blue Shield, this is important. Hackensack Meridian hospitals will no longer be in-network providers with Horizon unless they can come to some sort of agreement. This is the email that I received today, and many of you probably received it as well. Apparently, they have been trying to come to terms, some kind of financial term, but according to Horizon, Hackensack Meridian wants too much money from Horizon, and they cannot come to an agreement, and therefore, effective June 1st, the following hospitals will no longer be part of the Horizon Hospital Network. Bayshore Medical Center, Hackensack Meridian Health Carrier Clinic, Hackensack University Medical Center, Hackensack UMC Mountainside, Hackensack UMC Palisades, Hackensack UMC at Pascack Valley, Jersey Shore University Medical Center, JFK University Medical Center, Ocean University Medical Center, Old Bridge Medical Center, Raritan Bay Medical Center, Riverview Medical Center, and Southern Ocean Medical Center. So, one of the largest healthcare systems in New Jersey will no longer be an in-network hospital of Horizon. This does not affect patients with Horizon Medicaid or patients with Braven, which is also managed by Horizon. And ironically enough, Hackensack Meridian's employee plan is a Horizon plan, and it doesn't affect them. So patients with Horizon can continue to receive care at these facilities up until May 31st, 2025, the same way that you have been. After May 31st, 2025, you can continue to receive care at those hospitals for 90 days if you have a serious or complex condition such as a heart attack, stroke, or cancer. So let's say, God forbid, you get admitted on May 30th for a stroke. You will not start to become responsible for your care on June 1st just because Hackensack's no longer in network. Also true for inpatient medical behavioral health care services, a scheduled non-elective surgery or post-operative care, so an emergency surgery basically, pregnancy, or a terminal illness. Now let me give you a little background here. Several years ago, Horizon came out with their different tiers of hospitals. Hospitals that were tier 1 in network, patients could pay less to get care there. And if you were a tier 2 hospital, then if patients went there, then they would have to pay more. Hackensack Meridian, all their hospitals were tier 1. And there was no transparency. It was not clear how they decided who was tier 1 and who was tier 2, but it did not appear to be quality because some of these Hackensack Meridian hospitals were rated lower than some of the tier 2 hospitals, and yet were still tier 1 for Horizon. A lot of the tier 2s were small, independent hospitals, and so what happened was patients who had Horizon gravitated towards the Hackensack Meridian hospitals because they didn't have to spend as much if they got admitted there, which was to the detriment of the smaller hospitals and the hospitals that were part of smaller healthcare systems. But now, apparently, this is going to bite people in the butt because now Hackensack Meridian is no longer going to be in network with Horizon. So I don't know if suddenly the tier 2 hospitals will be upgraded to tier 1 and patients will be able to go to places that are closer to their home instead of having to schlep over to a tier 1 hospital. It's because it's cheaper.